Hello, Mr. Smith. How are you doing today?
Hello, sir. I'm good. How about yourself?
Doing pretty good. My name is Brandon Gavinsky. I understand you're here to talk about maybe some weight loss or something about that.
Yeah, I'm trying to get my diet right, and I've been trying to be more conscious of it now that I've got a couple issues going on.
Mm.
So,
Okay. Well, I'll just go ahead and ask you a few questions. It won't take too long, and I'll talk a little bit about some of your conditions, stuff like that. The process. This will go pretty quick. I'm not trying to keep you here all day, but it should be pretty informative for you.
okay, well, good.
But yeah. The first one, what's your normal diet look like?
I'm on the road a lot with my job, so I tend to eat out pretty frequently. Now, when I do eat out, I make sure to try to get like the better quality stuff,
Yeah.
from like fast food restaurants, but you know, that's kind of my bad area, if you will. But
Okay.
that's my normal routine. I try to eat a decent dinner at home.
Okay. Yeah. A lot of fast food places put a lot of salt and stuff in there, and I know you said you're trying to go for the better stuff. Do you normally go for grilled options or do you go for fried options?
I mean, typically speaking, I go for the fried stuff. It tastes
I mean,
better.
it's the better stuff. I mean, I completely understand that. It just tastes so good.
It does, yeah.
But on the other hand, we do want to, you know, work together and get you on a healthy diet plan. That way you can contribute to your weight loss and everything and be personally responsible for it instead of just relying on medication and stuff like that.
Okay.
So this is the main thing is controlling diet and exercise on your part. That's how you can take control of your own weight loss and be able to be the one who determines how healthy you want to be.
Okay. Well, I like the sound of that.
Oh yeah,
Being in control of my own body.
exactly.
Yeah, I like that.
But with the diet, I would recommend because you do have a few other conditions. A DASH diet is normally really good for like high blood pressure,
Hmm.
or the Mediterranean diet. That's really good as well for reduced chance of cardiovascular disease and other issues such as that.
Okay.
Those two diets, they're a little different but pretty similar. The Mediterranean one just focuses on not having, well, it's like unsaturated fats. It chooses like to have a healthier form of the fat compared to the fats you get in like chips and stuff like that.
Okay.
And then the DASH diet, it's more focused on having a bunch of whole grains and vegetables and fruits and balancing your different servings. And if you have dairy products, low fat.
So let's focus on the Mediterranean.
No, okay.
For me, just off the sound of it.
Yeah. Well, that one's more. I'll give you a printout of both of them and see which one you like
Okay.
afterwards. But that one, it's more like you'll eat a good amount of fish and stuff like that, stuff with healthy fats.
Okay. Well, that I could definitely do that. My biggest thing is I like meat.
Yeah.
I'm a protein eater, so
Oh,
like I'm definitely a carnivore.
both of the diets do consist of a good amount. Like you'll probably get a quarter of your calories for the day.
Okay.
Yeah, from your proteins,
Okay.
and some from legumes and nuts and stuff like that as well.
So I like almonds and
Yeah,
nuts and peanuts, and I don't have any allergies there. So.
well that's good.
Hmm.
Okay, so I'll give you printouts at the end, and that way you can determine. Okay, this looks good to me, and you'll have a reference to refer to whenever you're going throughout your day.
Yeah, that'd be awesome because then I can, kind of balance them out and see which works best for me.
Exactly. Now, exercise.
Okay.
How's your normal exercise activity level?
I mean, so I would consider myself an active individual.
Mm-hmm.
Um, I move a lot. I don't try to sit sedentary too much. I should probably work on actually like weightlifting more. Like
Yeah.
I swim. I got a pool at the house, so I swim. More frequently since the pool's been going.
Well, that's great.
Um, kind of got a little knee issue, so I don't run like I used
Yeah.
to. But you know, I try to stay healthy and try to stay active. But I would say a rigorous workout, less than 30 minutes a day.
Okay. Well, I mean, honestly, that's not too bad. You want to have moderate to vigorous activity, 150 minutes per week.
Okay.
So if you do go out 5 days for 30 minutes, just do some laps in your pool,
Mm-hmm.
you'll be good on that front.
Okay.
Now, I do want you to do 2 to 3 days. You'll do resistance training, like a form of strength training, like just do curls and all, or put leg work out with your leg. How
Gotcha.
you can do the press,
Mm-hmm.
similar to those. We'll just focus on the major muscle areas, and that, along with aerobic exercise, has shown to have more effect on weight loss.
Really?
Yes, sir.
Okay, so we just need to tie in the resistance training, like the strength-based stuff,
Yeah,
into my like swimming.
yeah. And you should be good to go there. And that's just 2 to 3 times a week for the strength training, so it's not too bad.
Okay, and I've been trying to swim at least 3 to 5 times a week,
Yeah.
so that kind of coincides with what you were saying. You said
Okay.
150 hours.
150 minutes.
Oh, okay.
You're not swimming the whole time you're living.
Yeah, I was about to say, yeah, true, I'm not a fish.
But yeah, so just 30 minutes 5 times a week, or because we really don't want you to be sedentary for. That's why we want to spread it out compared to. I'll get all my 150 out for the day, and then the other 6 relax.
Gotcha.
So it's
Okay.
better to spread it out between the days compared to just piling it all up.
Okay, that makes sense. That makes sense. And that paints a better picture for me too, because now that we're getting the diet right, it helps me have a route to go that I can have a say so in it as well, like you were saying.
Yes, sir. And that's pretty much all it is for the non-pharmacological therapy.
Okay.
Now, I did notice you had some other comorbid conditions.
Hmm.
Um, if you don't mind me talking about them.
No, I don't know.
Okay. Just hypertension, diabetes, and hyperlipidemia.
Yep.
Some of the medications they would normally prescribe for you, for hypertension, they'd most likely give you an ACE inhibitor or an ARB or a calcium channel blocker. I know these are all just big words I'm throwing at you,
Okay.
but most likely you'll be on lisinopril or something similar like that. And for those medications, for an ACE or an ARB, you want to, if you have like a dry cough come up every now and then, like you're just that's just bothering you, because that's one side effect that normal like it occurs in some people. So
Okay.
if you have an issue with that come up, then we'll be able to switch you to one of the other ones. That's just something to look out for. Other than that, it's a very good medication, and it will help to lower your blood pressure,
Okay.
and along with you losing weight, that will help you to lower your blood pressure as well.
Gotcha. Okay. So, and that'll pull me back down to a normal range.
It should. Yes,
Okay.
sir.
Okay.
And if it doesn't, we'll reevaluate in a month and maybe have to put you on a higher strength. But the goal is for if you get everything right and we're working on it and we get you back to a normal healthy weight,
Mm-hmm.
you might not even need it.
Really?
Yes, sir.
So we could move just based on dieting and how I eat and exercise. Eventually, we could possibly move off of medication.
Yes, sir. Now,
Wow.
the only ones that you would have to keep up with
Hmm.
is for diabetes,
Well, yeah, yeah.
because that one you can't. The pancreas is already, it's not releasing as much insulin as it should, so we got to substitute it somehow.
Right. Right.
Yeah.
Yeah, or else, I mean, I've had a experience, I feel pretty bad if I'm not right. So,
Yeah, I completely understand that. But now for diabetes, there are multiple options that actually help with weight loss as well.
okay.
Metformin, it shows slight weight loss in normal
Hmm.
diabetic patients, and on top of that, it's the number one medication for a diabetic.
Really?
It's recommended for every diabetic patient unless they have like lactic acidosis, which you don't really have to look out for it. You just if you're cramping a lot and stuff like that, let me know, and then we'll reevaluate it.
Okay. Well, so far, I mean, well, I know I'm not on that yet, but I don't really have like cramping problems or anything. So.
Okay, well that's good. Yeah, but it's a great medication. You'll just take it twice a day as prescribed, and it'll help you to balance out your blood glucose a little bit.
Okay.
And in addition to that, liraglutide,
Mhm.
that medication, it's an injection. A lot of people don't like that. Or would you be okay with that? Because it's one of the main weight loss medications for a diabetic patient.
Where do we do the injection?
Either abdomen, arm, or leg.
So I'm not super comfortable with the abdomen, but
You can do your arm or back of your arm or your leg.
I could do that.
Okay.
Yeah, the needle doesn't get me. I'm fine. I'm fine with that. Like I give blood a lot, so.
Okay.
But just something about the stomach just gives me the chills.
No, I completely understand that. But with that medication, it's easy peasy. You don't have to like draw up anything and inject it in yourself or anything like that. It comes in a little pen, stick it in, press a button, good to go.
Okay.
So it's simple, easy breezy.
Okay. Well, yeah. I mean, I'll give it a shot. Like
Okay.
I'll definitely, because I mean, does it work the best?
Yes, out of most of the weight loss medications, that one has shown to have some of the highest weight loss.
Okay. Well, I mean, yeah, I could give it a shot. If I could do it in my leg or my arm, I could make that work. I don't know if I could do my tummy.
No, I completely understand. But yeah, with that medication, they're using it just for weight loss alone as well, not just in diabetic patients. That's how good it is.
Hmm. Okay. Well, yeah. I mean, it sounds like a pretty good setup. I think we can, I'll give it a try, and I don't see having any issues with it. If it all helps me get some of this weight off and get back to how I looked at 21, I'll be good with it. So
Yes, sir. That's the plan.
awesome.
There was one other thing I wanted to talk to you about. It
Sure.
was your hyperlipidemia. It just
Okay.
means you have a little bit of the too much of the bad fats in you, like your LDL
Hmm.
or VLDL. Um, those those are what if they build up too much, they increase your chance for stroke and
Mm.
a cardiovascular event like that. So it's a pretty serious thing, but as long as we keep it in control and keep your levels in control with diet, as we talked about earlier,
Hmm.
and with this medication, should be fine because it won't keep building up and building up. It'll actually regress or stay the same.
Okay. Well, yeah. I mean, I definitely don't want the latter of those consequences. So
No, none of us want that.
no.
And that's why it's very important that you take all the medications as prescribed.
Okay.
This one, it's just going to be once daily. It's going to be a statin. I would have to look at your A1C levels to see, or your LDL levels, and see if you should be on a high intensity, moderate, or low.
Hmm.
After I reevaluate that, then we'll go ahead and put you on the correct strength, and you'll just take it once daily at bedtime, and that's it.
Okay. Yeah, we can do that for sure.
Okay. Well, that sounds great. Um, and if there are, there is always the option of surgery, but I don't really recommend that unless you're very obese, like in 35 or higher BMI, which you're not there right now. Personally, I think as if we make these changes, you wouldn't have to go that route. But they do. It is always an option where one of it they literally put a band around your stomach to make you feel more full.
I've heard about these. I've got a
Yeah.
buddy who has one.
Okay.
Yeah. No, I
But
don't want surgery.
I completely understand that, and I think it's better to just change up your diet and exercise routine. It's a little easier
Hmm.
and less complications.
Well, and I mean, it sounds like a pretty intrusive surgery anyway. So
It is with a good amount of recovery time.
I'm a lot more of a naturalist, so if we could do it with medicine and dieting and working out, that's the route I want to go.
Yeah, and this will teach that. Like if that's just a quick fix compared to you making lifelong changes that will benefit you and put you in control of your own weight.
Right, and that's what I want. Because either
Yeah,
way, I mean, if you limit my capacity on my stomach, I could still see where I would still have the desire to do the same routine.
yeah.
So, no, I think I like our plan. I don't want surgery, so let's go through with that. I'll try the injection, and I'll take the medicine, and I'll work on dieting, and I'll work more on doing some resistance training.
All right, that sounds great. Did you have any other questions?
No, honestly, I think you've wrapped it up really well for me. So thank you very much. I'm just gonna continue like we said, and I'll let you know how I'm doing with the injections.
Okay, that sounds great. Yeah, and if you have any reactions or anything, just let me know. Give me a call. We'll be able to change up stuff for you and make it quick and easy for you.
Okay. Well, awesome. Well, thank you very much.
You're very welcome. Now you have a wonderful day.
Yes, sir. You too. Thank you.
Thank you.